Hi, guys. It's Whitney Gibson, registered dietitian working in the bariatric and medical weight loss space. I'm also the founder of Level Up Bariatrics. Thank you so much for joining me for this masterclass. This one is titled Acid Reflux After Bariatric Surgery. We're going to cover diet and lifestyle interventions to help keep it at bay. So, the reason we're doing this one is because this is such a prevalent issue. I want to give you the why behind it's happening and symptoms, how to get to know the symptoms. Are you really experiencing severe acid reflux or is it something else? You want to kind of start being your own little detective. If this is something that you suffer with, then where is it coming from? Okay. So I just kind of want to break this down into the why, what is it, that kind of stuff. And I think you'll gain some clarity. If I can just move pages. This is so inconsistent. Okay. All right. So, as an introduction, we're going to talk about what is acid reflux. So, it is a condition where stomach acid frequently flows back into the esophagus. So, you're going to see here where the stomach acid is. It's within the stomach. This is not your size stomach after surgery. This is a normal size stomach. But nonetheless, here's your stomach acid. Here's your esophagus up here. And you've got a sphincter right here, right where at the bottom of your esophagus and above the stomach. That's called your lower esophageal sphincter. And we don't want that acid coming up. So let's talk about why it's doing that. So, why does bariatric surgery specifically sometimes worsen acid reflux? So, we've got different procedures here that has to do with weight loss, and that's going to be your gastric sleeve, otherwise called your vertical sleeve gastrectomy. You've got gastric banding, Roux-en-Y, or your gastric bypass. So, with the gastric sleeve, you have a reduction in stomach size. This procedure involves removing a large portion of the stomach, leaving a narrow tube-like structure, which you now have after surgery. And this can cause an increase gastric pressure, okay, stomach pressure, and reduce the capacity to hold food, leading to more frequent reflux. So it's really the capacity in comparison to your gastric pressure. So we got to keep an eye on that, and we'll talk more about that. But I also wanted to explain the lower esophageal sphincter. It's called the LES as well. So changes in the anatomy can alter the pressure dynamics of the LES. So depending on what surgery you've had or what's going on inside, it can potentially weaken its ability to prevent that acid backflow back up into the esophagus. Okay. So we'll talk about certain things that might weaken that pressure. And then we have gastric banding. So with band placement, your gastric banding is an adjustable band that's placed around the upper part of the stomach to create a pouch. Many people started with gastric banding before maybe opting to move on to a sleeve, or maybe they reached their goal weight, you name it. But irregardless, if you have a band or if you've had a band, this is what happens. It's placed around the upper part of the stomach to create a small pouch. So this additionally can increase intra-abdominal pressure, pushing the stomach contents back into the esophagus. So if you can kind of visualize that, it kind of makes sense. And then we have Roux-en-Y, gastric bypass. And here you're going to have altered anatomy. So while this procedure often improves reflux symptoms, a lot of people may end up opting to have this procedure as a revision because of the severity of the reflux. But in some cases, the small stomach pouch and rearranged intestines can still result in bile reflux. This is not acid reflux. This is something different. We're not going to talk about it. But that does exist. But Roux-en-Y usually will be opted for to relieve the severe symptoms of this. There are other procedures we'll talk about, but not in depth. So, causes and risk factors. So, we want to understand acid reflux after surgery. So, we've already talked about the anatomical changes. We've got the lower esophageal sphincter dysfunction. So, remember that LES, or the lower esophageal sphincter, at the bottom of your esophagus. It's a ring of muscle at the bottom of the esophagus. It acts as a valve. Let's just call it the gatekeeper of stomach acid between the esophagus and the stomach, or stomach contents, I should say. When it does not close properly, acid can escape into and up into the esophagus. Types of weight loss surgery, we just discussed that. So there's higher incidences in procedures like the gastric sleeve and gastric banding. And then we have other factors such as weight loss, dietary changes, and lifestyle adjustments. So with other things happening, so we talked about the anatomical changes, hiatal hernias. Let's talk about hiatal hernias. So even if you haven't had weight loss surgery and maybe you're overweight, you don't even have to be overweight. Maybe you have a hiatal hernia in general. That creates, oh, that's a condition where the upper part of the stomach bulges through the diaphragm into the chest cavity. So this can become uncomfortable. It can also affect everything going on in your stomach and put extra pressure. So a lot of times, if you have a hiatal hernia, which they check this prior to you going under for your procedure, but if you have a substantial or significant hiatal hernia, they'll likely remove it during the procedure itself. But there's always option for hiatal hernia repair if it's bad enough, if that's the cause of your issues. And then obesity in general. So excess body weight can increase the pressure on the abdomen. So there's no, there's no wonder why when you lose weight, this becomes a lot better. You can feel relief. So there's not as much pushing up the stomach or pushing the stomach, causing that acid to back up into the esophagus. So you may notice an improvement with your acid reflux, even without medication, as you obtain a healthier weight. That's not me telling you not to take medication. You may need it for a little bit of time, but that's something you will discuss with your provider. Okay, and then certain medications, I don't have this on here, but certain medications like aspirin, ibuprofen, muscle relaxers, or blood pressure medications can cause increased acid production or the weakness of that sphincter. And then diet and lifestyle changes. Or diet and lifestyle, we will talk about these too, but eating large meals, lying down after a meal, consuming fatty or spicy foods, caffeine, alcohol, and smoking, those are all considered dietary and lifestyle. We'll discuss those in just a second too. So I want you guys to recognize the signs of acid reflux. Knowing the symptoms can really help you identify whether you are experiencing severe issues or how severe they might be. So here are some signs. Heartburn, of course, a burning pain or discomfort that may move from your stomach to your chest or even up into your throat. So you can feel it, a pretty good ways from the stomach up to the throat. Regurgitation. Now, this isn't vomiting, but maybe this is one of those times where you feel like you've thrown up a little bit in your mouth. So you will feel or you'll taste a sour or bitter tasting acid backing up into your throat or mouth. Dysphagia. So this means difficulty swallowing. So you may have this along with that last one, like a sensation of a lump in your throat. Sometimes that may make it feel like it's difficult to swallow. Feels like there's a rock or a lump in your throat. Something is stuck. It's usually a little bit lower in the throat. And chest pain, especially when you lie down or at night. So this may be contributing to the heartburn, or the heartburn may be causing the chest pain. Chronic cough, or the need to feel like you're constantly clearing your throat in maybe a more audible way. Hoarseness in the throat. So imagine, that persistent irritation in your throat from acid. It may cause your throat to become sore or your voice to become hoarse. And then we talked about the lump in the throat. So those are the signs. And then we want to go into some dietary interventions. So it's so surprising to me, but maybe it's not. I don't know. There's not a lot of talk behind, how to dietarily intervene with these issues. It's just like, here's medication, but we don't want to promote those medications unless they're absolutely necessary. Those medications actually have a higher risk long term if you're taking them long term than something else, like maybe more natural approaches. You really have to it's an individualized approach. I'm not saying everything is for everybody, but we can at least start with this. If we assume that maybe these foods are in our diet on a regular basis, then start cutting them out. Spicy foods, start with that. Citrus, tomato-based products, chocolate, caffeine, and alcohol. So all of those are going to be trigger foods. So if there's a mixture of those in your diet throughout the week, you need to kind of start thinking about, well, what can I start to cut back on? 9 times out of 10, the culprit is caffeine, guys. If you would simply cut down some of the caffeine, get more natural sources of nutrition that would actually wake you up. Do not depend on caffeine. There's more than one reason why I tell people after surgery to not depend on caffeine. There's way too much precious space in your body or in your stomach at this time. And the way you absorb things and the way you feel, like you're just way too affected. Caffeine can really affect the appetite. It can be a dehydrator. I mean, there's 10 reasons why. So caffeine only in moderation. Try to limit it at 1 cup per day. If you're finding yourself being tired throughout the day and you're dependent on caffeine, you need to take a closer look at your nutrition and your lifestyle, because it is not the fact that your body needs caffeine. So that's my little speech there. But fatty foods, also high fat foods, especially fried foods or animal products that are high in saturated fats, are going to be a problem. So if you're one that has a lot of fried food, cut it out. If you want to back off the animal products like your steak or your hamburger meat, or what else is there? Red meats. Let's just say red meats. They're going to be higher in fats. So just, kind of take a look at your diet. What's the snapshot? What are foods that are highest in animal products and fat? So maybe that's a place for you to start as well. And then foods to include. So this is kind of, I shouldn't say a no-brainer. There's actually specific things on here, but foods to include to kind of keep acid reflux at bay. Lean proteins, chicken, fish, turkey. You just have to think about how you're cooking those. So baked, broiled, air fried, pan seared. I don't know how you want it, but as least amount of oil as possible, or fatty cooking methods as possible, then that's what you want. Low acid vegetables. So these are going to be more alkaline for the body. Green beans, broccoli, leafy greens. Ooh, let's go back to citrus. So people usually, they'll be like, oh, lemons are a citrus. It causes acid reflux. I shouldn't have it. Lemon actually is acidic outside the body, but when it's consumed, like let's say you put it in water, it's alkaline. So let's say broccoli with lemon on it. Ooh, super alkaline. That's really great. If you are putting lemon in your water on a regular basis, alkaline. It's going to neutralize the acid in your stomach. So keep that in mind too. That's why lemon water is such a, people say to drink it all the time, because it is very alkaline and we tend to be acidic. So whole grains such as oatmeal and whole grain breads, and then non-citrus fruits like bananas, melons, apples. How to eat to prevent acid reflux. So these are more behaviors or eating habits. You want to eat small and frequent meals. We all know that. It helps to reduce the pressure on the LES. So not as much pressure in the stomach. Chewing thoroughly. So this is something that a lot of patients have difficulty getting used to, just because you've gone through a lifetime of maybe chewing fast and eating fast. So chewing very thoroughly, make sure it is complete mush before you swallow it as much as possible, because that's less work your body has to do to digest it. So chew, 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 and you will be better off. Avoid lying down after eating. Wait at least 2 to 3 hours before lying down if you are having these issues. Now, I do have bariatric patients who they're like, oh, I'm not going to meet my protein intake or my calorie needs unless I'm eating at this time before bed. And I'm like, whatever. I mean, it's an individualized approach, honestly. So, but I'm saying the 2 to 3 hours is going to apply to people who are suffering with acid reflux. Behavioral changes. So weight management, this is obvious. You've had bariatric surgery. You're trying to obtain a healthy weight. But obtaining a healthier weight, even as you begin to lose weight after surgery, you may experience relief in your symptoms as you lose weight. You want to elevate your head while sleeping if you need to. You can use a wedge pillow to keep the head elevated. You can sleep in a recliner if you're having really bad issues. Even being on a recliner, even in a recliner, can be troublesome. So this is why we say do not eat 2 to 3 hours before bed. Don't assume that you can just lay in a recliner and be okay. You might not be able to. Avoid tight clothing. This is a big one. I don't know how many of you are wearing tight clothing, but especially the pants. So think about where your pants are hitting you. If that's really tight there, you're on your stomach. So you're really increasing the pressure on the abdomen, not doing good things for your stomach. So avoid tight clothing. Other tips, I'm hoping everyone stopped smoking prior to surgery, but smoking can weaken the LES. So we want to avoid smoking. That is a common culprit that we see in the medical space as a cause of GERD or acid reflux. You want to stay hydrated, drink water throughout the day, but avoid large amounts during meals. Sips are okay, but adding a lot more water or more water than what you need to your meal can very much cause just too much pressure in there. Regular physical activity, I tell everyone to walk after their meals. You know, if at all possible, if you're in in an area where you can do some kind of physical activity, not exercise. I'm not asking you to exercise after a meal, but walking, just simply walking after a meal can really aid in digestion. And if we're aiding digestion, what are we doing? We're lessening the effects of acid reflux. All right. So, what do we do when lifestyle changes are not enough? So, there are medications. It's likely that you were started on a medication uh, day one out of surgery, or maybe day two. I don't know. But a lot of people will prescribe for the first 3 months and start to wean their patients off. Every office is probably different. I can't speak to other offices, but in my experience, this is what they had done. May look different for you. So there are different medications out there. You may have just simply an antacid like Tums. Maybe that'll do the trick. But you may also have to be on an H2 blocker, proton pump inhibitor, just some kind of acid blocker in general. Do we want you to be on these for long-term periods of time, like the PPIs? Absolutely not. These can cause imbalances with your labs, with B12 levels, iron levels. And if acid reflux is not resolved for the most part, or if there's not an intervention in due time, you are increasing your risk for Barrett's esophagus. We cannot have, all that acid just sitting in your esophagus all the time. So if you're struggling with this, you need to go get a medication or ask your doctor about a medication. If your prescription or your medication is not working for you, there are other options out there. So it is worth it to try different things so that you can, help alleviate this. And if you're doing the medications, if you're doing the lifestyle changes, you're doing all the interventions that you can think of, then you may want to consider a surgical intervention. So potential surgical interventions may include a revision. I put revision to sleeve. It should be from sleeve. Revision to bypass. That's what I should have put. And Nissen fundoplication. That's another procedure. I'm not sure how often that's performed in bariatric patients. I don't have any statistics for you, but I'm sure there's other medical advances and procedures that they can consider. Of course, as with anything, everything is individualized. So if you are having these issues, please check up with your healthcare provider, regular check-ins to monitor your medication, manage your symptoms, all that jazz. And don't forget to visit your dietitian if you're having issues with creating a good meal plan for yourself, or I don't want to say meal plan. I hate the word meal plan. A good routine for yourself, or a good, variety of foods. If you're having trouble with that, please visit with your bariatric dietitian. They will help you. So key takeaways from today: importance of diet and lifestyle. These are the primary methods for managing acid reflux post weight loss surgery. No one should be ever just dependent on medication alone. This is a very individualized approach. Tailoring interventions to your individual needs is necessary. So this is why you will go to your provider. You will talk about your symptoms, list everything down. What are you currently taking? What have you taken in the past that didn't work? All that stuff. Have these conversations with your surgeon or doctor. And then ongoing management. You want to have regular monitoring and adjustments for long-term relief. So I'm hoping this was helpful for a lot of you, and I'm hoping that you won't struggle for very much longer if you're struggling. But if you're looking for more support, again, I am a bariatric dietitian. I have programs. I design my programs for my patients and for my community. I offer all kinds of things. So visit our website to learn more about what we offer. It's primarily membership based, and we offer one-on-one coaching. We also have a podcast, the Level Up Bariatrics podcast. So we're a little bit of everywhere. You can simply scan this QR code on the screen. It will send you to the website. Just peruse the site. We've got some blog articles on there. We've got some, the services tab will show you what we offer and the pricing. And then we've got that's where your membership is too. So if you decide you wanted to sign up for the membership, that will be your login page as well. And you will have access to all kinds of stuff, past workshops, master classes, support groups, you name it. So if you're interested in what we offer in the membership or one-on-one coaching, please go to that website. You can go to contact me or book a free discovery call. You can reach out to me via Facebook, email, you name it, however you want. If you got my number, you can call me. But I really, really appreciate you guys attending today. And we will catch you in the next workshop. Bye, guys.